Hello, everyone. This is our group. Our project is infection control, focusing on hand hygiene. In this project, we aim to improve hand hygiene compliance among healthcare professionals in the ICU or med-tele units to reduce healthcare-associated infections and improve patient outcomes. Our group will discuss the current situation, potential causes of non-compliance, and our plan for improvement. The objectives are to increase awareness, provide education, and promote a culture of hand hygiene among nurses in the workplace and ICU.
One of the leading causes of death and morbidity in healthcare facilities is associated with healthcare-associated infections. An estimated 7% of patients in developed nations and greater than 25% of those in developing countries suffer from healthcare-associated infections. If done properly, various studies have shown that multi-modal hand hygiene techniques can be effective in reducing the spread of pathogens in healthcare facilities. Unfortunately, studies reveal that many healthcare workers practice hand hygiene less than half of the times that they should. This can contribute to the spread of infections that can affect up to 1 in 31 hospital patients on a daily basis. For this reason, our opportunity for improvement is on ensuring that our healthcare workers adhere to proper hand hygiene guidelines and identifying barriers to hand hygiene compliance.
All right, so I'm going to be talking about data analysis. The first picture that you see here is basically a patient laying down in bed at a hospital setting. So pretty much you should have washed your hands or used the hand sanitizer before you even touch your patient. And once you touch your patient, you should put on new gloves. If you want to clean or do an aseptic procedure, you should also wash your hands. And then once you remove the bodily fluids, wash your hands, change your gloves. And then after touching a patient and after touching patient surroundings before you get out, you could either wash your hands or use hand sanitizer. The graph here on the right hand side, this was collected as a real data during a code on my first day when I was in the ICU. We had a code on med surg floor which we attended, and when I got there and everyone was just rushing in, majority of the healthcare team members didn't gel in, so they just rushed to the patient, just put their gloves on, and once everything was controlled, what I noticed was majority of these nurses or the healthcare providers were gelling out, and few of them even washed their hands. And this study I was able to find off of Google. This was done in Ethiopia. I couldn't find anything here. I don't know why. But this study was conducted to assess hand hygiene compliance and associated factors among healthcare providers in a public primary hospital in Ethiopia. And here's what it says: non-accessible to like people didn't have, or the nurses didn't have any access to the sink, and 53% didn't wash their hands, they just wore gloves. 66 said they did not have any time. 72% didn't want to use any of the hand sanitizer or wash their hands frequently due to that it damages their skin or skin irritation. 86% said that it wasn't important in every patient, and 86% got offended. 88% said that my hands are not dirty, and 89% said that it doesn't apply to their practice. So in conclusion, the overall level of hand hygiene and compliance among healthcare providers was poor. Training, availability of adequate soap and water, availability of alcohol-based hand rub, knowledge on hand hygiene, and attitude of healthcare providers were significantly associated with hand hygiene compliance.
In a QA study conducted in 2 PICUs in 2 different hospitals, RCA was used to identify the barriers affecting hand hygiene compliance. Interventions implemented to conduct the study included hand hygiene training and education, video presentations in the hospital, posters, gentle verbal reminders, and hand hygiene champions for auditing and follow-up. The first step in RCA is to identify the problem and then to analyze it by asking why decreased hand hygiene compliance happens. The causes of non-compliance to hand hygiene were classified into 5 categories: people, environment, policies, procedures, and materials. Under people was lack of knowledge, lack of role models, forgetfulness, skin dryness. Under environment was lack of leadership, work intensity or patient load. Under policies were this is a little messed up here. No strict policy or punishment. Under procedures were lack of time. Under materials were inconvenient locations of sink and alcohol dispensers and having no paper towels available. It was also identified that skin dryness, forgetfulness, and work intensity or patient load are the highest barriers to noncompliance.
So hand washing and also using hand sanitizers is very important in preventing and spreading the infection in healthcare facilities. So for our implementations, we'll be reminding employees of the importance of hand hygiene, provide in-service education and the importance of hand hygiene to healthcare workers and staff, provide adequate supplies for performing hand hygiene such as hand sanitizers and sinks, and also encouraging employees to speak up if they see another employee failing to follow hand hygiene protocols. So the solution to our implementation will be posting a hand washing and hand sanitizing sign near the sink in the nurse's station as well as in the bathrooms, distributing current policy and procedure handouts on proper hand washing technique in the units, educate healthcare workers and employees on the safety benefits of proper hand washing with demonstration as a checkoff, and also providing nurses with personal hand sanitizer bottles to keep in their pockets.
Okay, so the results, overall, a significant improvement in hand hygiene compliance, which went from 55 to 69%, was detected in ICUs following implementation of the hand hygiene strategies listed before. Hand washing and the use of hand sanitizers in 30 different ICUs increased from 36.9% to 60.4%. This shows that the permanent availability of alcohol-based hand rubs improved hand hygiene from 70% to 100%. ICUs that made pocket bottles available to healthcare workers saw a 92% increase compared to the 52 at baseline. The percentage of healthcare workers who underwent training on hand hygiene also increased from 39.7% to 86.6%. So identified areas of improvement. Identified areas that need further improvement are the staff's understanding of microorganism transmission and different roles and tasks related to patient care. So for example, hand hygiene compliance before regular patient contact only increased from 49 to 65%, whereas hand hygiene before an aseptic clean task increased from 53 to 70%. So what that basically means is that staff are more likely to wash their hands before an aseptic task versus a regular patient interaction. So staff are more likely to, basically what that means is staff need to be washing their hands all the time and not just before aseptic tasks.
So in conclusion, our project emphasized the importance of hand hygiene in preventing healthcare-associated infections and improving patient outcomes. We identify areas for improvement, implemented a plan, and saw a significant increase in hand hygiene compliance among healthcare professionals. To maintain progress, ongoing monitoring, education, and promoting a culture of hand hygiene are recommended. And that's it for our presentation. I hope everybody enjoy watching our presentation and learn the importance of hand hygiene.
Don't forget to wash your hands.
Bye.